So this week we're learning about medical records, and I just wanted to give you an overview of a very common structure or outline that your medical records may take. In school you'll learn a lot about what's called SOAP notes, or in some places HEAP notes. These are acronyms that help you remember the organizational structure that most of your notes will go through. So the S or the H, the S stands for subjective, the H stands for history. In this first section, you'll explain the patient history, anything that the client told you about why they're there, details about what's been going on with the patient, and also any answers to questions you pose that the owner gives back a subjective answer. The next section is O for objective or E for exam, and in this section you put the medical details and facts. Objective is kind of misleading because objective information is usually used as a measurement or a number, and we don't restrict this category to only truly objective data points, but rather put our medical perspective into this section. Even though one of your findings may be subjective, like a stomach feels firmer than normal, this still belongs in the exam section or the objective section because it's a medical finding. Of course, you can also put data points in this section, such as the patient's temperature and the heart rate. If you have any immediate test results, you can put them into this section. The next section is A for assessment. The assessment section is where you organize your thoughts. You make a list of problems, you make a list of possible differentials or diagnoses in the case, and if you actually have made a final diagnosis, then that is listed here. The final section of the notes is called P for plan. This is where your diagnostic plan will go, as well as any treatment suggestions that you have. You may have treatments even before you have a diagnosis, as in symptomatic control of a problem. Then you may be looking for other information by sending out blood tests or taking x-rays, and you would list any future plans here. Any instructions you give to the owner, such as how to handle their animals and when to give them medication, belongs in this section, as well as any information about when you plan to recheck the animal or what you plan to do to follow up on the problem. You will find several examples of notes arranged in a SOAP or HEAP format, as well as some templates that are available in the next section.